Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You've joined us for our series In the Know, where we make it simple. Today we are simplifying the respiratory system.
So let's make no mistake about respiratory hacks and tricks there are to know about making the respiratory system make more sense. We're going to waste no time. We're going to get right to our drawing here, and we're going to draw a little bit of stuff for you to make the respiratory system make more sense. So this is a lung, believe it or not. I'm not known for my drawing. This is a human lung, and this is the vascular space that runs underneath of the lung. So that's, a fancy nursey word for the bloodstream. And this is the lung, okay? The whole point of what the lungs do is they bring oxygen into the bloodstream. So we get oxygen in, and we want to get CO2 out. So CO2 is an acid. We get rid of CO2 by exhaling, and we get oxygen into our lungs by inhaling. It's fundamentally important that you understand that the whole point of the lungs is to get oxygen in and to get CO2 out through expiration, because of course, if there's anything impeding what we know this as the gas exchange, if anything is impeding this, we're going to run into issues with our patients. So let me draw for you what happens. Built up in our lungs. Say over here, this is filled up with fluid. Say a patient has pneumonia as an example. So can oxygen get into, if there's fluid blocking it? The answer to that question is no. Can CO2 get out if there's fluid blocking it? The answer to that question is also no. So the oxygen cannot get past fluid hanging out in the lungs or secretions, anything sticky, slimy, etc. And CO2 cannot get out of the bloodstream to be exhaled from the lungs. This is no different from over here. If we have a solid obstruction, this would be something like a tumor, which is obviously bad. However, if there's a tumor in the base of the lungs, can the oxygen get in? The answer to that question is no. And can CO2 get out past that tumor? The answer to that question is also no. So as CO2 then remains in the bloodstream, the patient becomes acidic. And obviously, as oxygen cannot get into the bloodstream, the patient becomes hypoxic. So what do we see then as clinical manifestations if this is taking place? We're going to see things like decreased oxygen saturation, cyanosis, dyspnea, so difficulty breathing, things such as this. Now, we can use this knowledge to make more sense of IPA. You may remember this from school as inspection, palpation. Oh, there's only 2 P's. I don't know why I drew 3. Inspection, palpation, percussion, and auscultation. So you know by inspecting your patient, if they have this going on, they're going to have signs of respiratory distress. We should all know what those are. Palpation. If you touch this over here where the fluid is, what happens is that fluid actually increases vibration. So if you feel for vibrations here or palpate, you're going to feel something called fremitus, which is increased vibration. And if you feel for palpation over here, you are going to feel decreased vibration or decreased fremitus. If you auscultate over here, you are going to hear crackles, and if you auscultate over here, you are going to hear diminished breath sounds. So just helping you make a little bit more sense of the assessment and actually understanding what's going on in the lungs. So what happens when you get no oxygen to your tissues, right? If we're not getting oxygen in, we're not getting oxygen delivery to our tissues. Well, put simply, what happens to your tissues when they don't get oxygen is they get dead, right? Tissues don't get oxygen, tissues get dead. If tissues get dead, organs get dead. And if organs get dead, people get dead. This is why it's fundamentally important that we get oxygen in and CO2 out.
Why does this matter? The lungs are our only way to get oxygen into our bloodstream. We need this oxygen to stay alive. We must have an unobstructed gas exchange. If we don't have this gas exchange, we call that impaired gas exchange. We cannot get oxygen into our bodies in any other way except through our lungs. So unlike blood loss or unlike fluid losses, where we can replace that with blood transfusions and intravenous transfusions, We cannot give people oxygen into their veins. It can only be replaced and maintained through the respiratory system. So this is why it is critical to understand and simplify the respiratory system. We hope this demonstration has helped make the respiratory system and assessment simpler for you. Be sure to tune into our video questions this week where we apply this knowledge to your registration exam.
Also, we invite you to subscribe to our live videos. If you hit subscribe, you'll be notified on your phone when we do go live on Facebook. We do content videos. We do a lot of videos around how to prepare for your registration exam, emotional coaching, a whole bunch of stuff, video questions. So hit subscribe and you'll always be notified when we're online. You can also subscribe to us on YouTube. Like and share this video with your nursing friends, and be sure to follow our Facebook page. And of course, always check us out on our website at www.N-Powerment Nursing.com, because if you like the way we teach this, we teach everything just like this. We have a whole textbook full of concept just like this, where we break down difficult things and help make them simpler for you. So we will see you next time. Bye for now.
Bye for now.